my name is Coral Hawking, and I'm going to be your student of physical therapy today. How are you feeling?
I'm feeling good.
Alright, good. And do you mind if I go ahead and just check your hospital bracelet real quick? And can you tell me your name?
Summer is over.
And your birthday's 4/18/1966?
Yes.
Alright, and that matches my records. Awesome. Do you know why you're here?
Car accident.
Yeah, you had a car accident. And do you know what day it is?
July 21st,
And do you know what year it is?
2020.
And where are we right now?
The hospital.
Okay, and can you tell me anything else about your accident that you remember?
I did a few rolls when I got out of the car, and I saw the tire on the truck in front of me.
Okay, and that's all you remember?
Mm-hmm.
Alright. You did have a car accident and you did have a little bit of bleeding in your brain, but everything's stabilized now and you had a surgery to relieve some of the pressure in your head. Do you remember that?
Yeah.
Okay, so that's why you have a little band-aid on your head there. They just kind of took off part of your skull basically to relieve the pressure before they put it back on. But they said everything went well and everything's stable. Something that they do want you to know, because you did have that, it's called craniotomy, is that you're not supposed to lift, push, or pull anything that makes your head hurt. You're not supposed to hold your breath to make your head hurt, and you're supposed to keep your head higher than the rest of your body to kind of elevate and make sure the pressure is equalized. Does that sound okay?
Yes.
Alright, so again, my name is Coral and I'm a student of physical therapy, so what I'm going to do is just kind of give you an overall exam. We're going to make sure everything's working properly. Then we're going to sit you up. I'm going to teach you how to get up and moving so you can walk around and we can get you out of here as soon as possible. Does that sound okay?
That sounds good.
Alright, awesome. So we're just going to take your temperature. Equals off. Look up. 98.6. Awesome. And I'm going to take your blood pressure and I'm going to take your heart rate, okay? I'm going to press it on the back with you. Alright, so we're just going to go ahead and just relax your arm. And we're going to take your blood pressure. Is that okay? Yes. We're going to use the arm that's not on the IV. Good job. Go ahead and just relax your arm. I'm going to help your sleep. Is that okay? Yes. Okay. That's good. Okay, so I'm going to pump it up once so I can get the right number, and then we'll let it go and we'll take it, okay? Okay. Does that sound okay? Feel okay? Yes. Okay. And if at any point you have any dizziness or discomfort, just keep me updated and let me know, okay? Number 60. Awesome. Thank you so much. Good. Do you mind if I measure it?
That's good.
Alright, and it is about 4 centimeters thick. Okay, so the first thing I'm going to have you do is just look at this eye chart here, and I want you to cover up your left eye, and I want you to just go ahead and read the first line.
E.
Read the next line.
F P.
Read the next line.
T O Z.
And the next.
L P E D.
Okay, and the next.
P E S F D.
Alright, go ahead and cover up your other eye. And go ahead and start from the top.
E.
And go ahead.
F P.
And the next.
T O Z.
And the next.
L P E D.
And the next.
P E S F D.
Alright, awesome. Thank you so much. Just lay it kind of near your eye. Is that okay with you? Okay. Alright, so I just want you to go ahead and just look at me. Awesome. Alright, and then I want you to go ahead and look at my finger, and I want you to keep staring at me, and I want you to tell me when you can't see my finger anymore, okay?
Can't see it.
Okay, and the other eye?
Can't see it.
Alright, and then I just want you to follow my finger now, okay? Would you put just your eyes?
Oh, sorry.
No, it's okay. Alright, awesome. Similar to what we did before with the dermatomes, this is going to be sharp and dull. So this is what sharp feels like, and this is what dull feels like, okay? And we're just going to do a trial run, and you're just going to tell me sharp or dull, okay?
Okay.
You close your eyes.
Sharp. Dull. Sharp. Dull.
Alright, awesome. Alright, we're going to go ahead and get started. I'm going to actually do it on your forehead, your cheek, and your chin, okay? Is that alright? I'm going to just get a little bit closer to you. Alright, ready?
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp.
Okay. Awesome. And then we're just going to, I want you to go ahead and bite down. Awesome. And go ahead and bite down. Alright, good. Okay, I'm just going to make noise by your ears, and I want you to tell me which side the noise is coming from, okay?
Okay. Left. Right. Left. Right. Left. Left. Right.
Okay, awesome. So the next thing we're going to do is pretty similar. I'm going to tap this and make it vibrate. I'm going to place it behind your ear. When you no longer feel it behind your ear, I want you to say, tell me that you no longer feel it. I'm going to move it to your ear, like outside of it here, and I want you to tell me when you no longer hear it, okay?
Okay, right. No longer feel it. No longer hear it.
Thank you so much. Ready?
No longer feel it. No longer hear it.
Thank you. And open your mouth and say ah. Alright, go ahead and close your mouth and swallow. Okay. And I am going to just ask you to shrug your shoulders up and don't let me move you down. Good. Go ahead and turn your head to the left. Don't let me move you. Ready? Good. Go ahead and turn your head this way. Good. And I want you to go ahead and stick out your tongue and go ahead and point it towards this way. Go ahead and point it towards this way. Alright, awesome. I'm going to vibrate. I'm going to put it on top of your head, and I just want you to tell me yes that you feel it and that it's equal on both sides. Like you feel it the same on both sides, okay?
Okay. I feel it.
Is it the same on both sides? Okay, awesome. Alright, so we're just going to do a few, they're called non-equilibrium tests, just to kind of check and see how everything's doing. So I want you to go ahead and put your arms out to your side, and I want you to take your right arm and touch it to your nose, and back out, and then your left arm, and back out, and then again with your right, back out, left, back out, and then both at the same time in, and back out. Awesome. The next thing that we're going to do is I want you to touch your finger to my finger. I want you to touch it to your nose, touch it to my finger, touch it to your nose, touch it to my finger, touch it to your nose. Awesome. And then we're going to do your fingers together. So I want you to put your hands out like we did the first time. I want you to bring them and touch your fingers together this time, and back out, fingers together, and back out. Awesome. Now I want you to point to my finger and touch my finger. I'm going to point past my finger, and then touch my finger, touch past my finger, touch my finger. Awesome. Okay. And I want you, the next thing we're going to do is you're going to take your heel, or go ahead and just separate your feet for me a little bit. You're going to take this heel and touch it to this knee. Go ahead. And then I want you to touch that heel to your opposite toe, and then back on the knee, and then back on the toe. Awesome. And relax. And I want you to do the same thing with the opposite foot now. Heel. Yeah, to knee, and then to toe, and then back on your knee, and then back on your toe. Awesome. And the next thing we're going to do is I'm going to put my finger up here, and I want you to try to touch your toe to my finger, okay? And back down, and one more time, and back down. Awesome. And your other foot, and back down, and back down. Awesome. Good job. Then the next thing we're going to do is I just want you to take your right hand, and I want you to try to grab and open up and close, and your other hand, we're going to do the same thing. Open, close, awesome, good job. And the next thing we're going to do is I want you to take your right arm and just kind of flip it like this, and you're going to flip it upside down, and then back over, upside down, and back over. You're going to take your left arm and put it out, upside down, back over, upside down, back over, and we're going to go at the same time, upside down, back over, upside down, back over. Now you're going to start with one flipped up, and we're going to go opposite. So we're going to go flip, both, a little bit faster, flip. So we're just going to check your sensory sensation on your body. Is that okay with you?
Yes.
Alright, so it's called a dermatome test, and we're just going to do a trial run real quick. This is what it feels like when I'm touching you, and this is what it feels like when I'm not touching you, okay?
Okay.
So we're going to do a trial run. I just want you to close your eyes and say yes when I'm touching you and no when I'm not touching you, okay?
Okay. Yes. No. Yes. No. Yes. No.
Okay, now we're going to do it.
Yes. No. Yes. No. Yes. No. Yes. No. Yes. No. Yes. No. Yes. Yes. No. 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 Yes. No
So I'm just gonna roll you onto your back so we can test a few things. Is that okay? Right, I'm gonna go ahead and just cross this leg over this leg. Awesome. And on the count of 3, I'm gonna just reach behind your back on your shoulders and kind of behind your legs, and we're gonna roll together. Okay? We'll roll into the side and we'll roll the rest of the way. Okay, ready? 1. On the count of 3. 1, 2, 3. Awesome. And then ready? 1, 2, 3. Good. I'm gonna get the arm out of the way. Are you feeling okay? Yes. You feeling dizzy? No. All right. Just gonna fix your down here. Right. We're gonna do the same thing just on the back. Okay? Okay. Right. Yes. No. 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 Awesome. Now while we're here, what I'm gonna have you do is just lift this arm in the air as high as you can. Right? And I don't want you to push you towards the back, okay? Right, good. Other arm. Okay, good. Go ahead and lift this leg in the air as high as you can. Ready? Don't let me move you down. Good. Other leg. Awesome, thank you. Alright, we're gonna go ahead and roll back over. Alright, you ready? We're gonna do that same log roll. Alright, ready? 1, 2, 3. 1, 2, 3. You feeling okay? Are you dizzy? No. You're right. You staying okay there? Alright.
I started.
Okay, go ahead and lift this leg up a little bit and back down. Go ahead and bend your knee towards your chest as far as you can, and then back down, and then bend it halfway, and don't let me move you down. Good. And then the other leg, go ahead and bend it as far as you can up and down, and bend it about halfway, and don't let me move you down. Awesome. And then we're gonna do the same thing with your ankles. Go ahead and point this one towards your forehead and down. Point it about halfway towards your forehead. Don't let me move you down. Don't let me move you up. Good. Go ahead and bend this one towards your forehead and down. Go ahead and bend it about halfway. Don't let me move you up, down. Don't let me move you up. Awesome. Okay, you can go ahead and.
You nodded.
Okay. So I'm just gonna scoot you over, okay?
Okay.
Just get that cord. 1, 2, 3. Awesome. And we're gonna go ahead and just bend your legs a little bit. And I'm gonna come up behind your head. And on the count of 3, we're gonna sit up. Ready?
Okay.
1, 2, 3. You feeling okay?
Yes.
You feeling dizzy?
No.
Okay. You can go ahead and put your arms out to the side and hold on just in case. And I'm gonna just put the skate up on you, okay?
Okay.
And put your arms up. While we're sitting here and you're not feeling dizzy or anything, all right, what we're gonna do is I'm just gonna have you set this here so I can see it, and we're just gonna go ahead and have you look up and down. Go ahead and come back to the center. Go ahead and look towards the bed and then towards the other wall. Back to the center. I'm gonna go ahead and have you put this ear towards your shoulder and back, and then your other side, and then back. Awesome. And then I'm not gonna do any muscle testing for your head because you just had your surgery. We are going to do some shoulder range of motion. So I'm actually gonna stand up here. I want you to go ahead and lift this arm in the air as high as you can. And back down, and go ahead and just keep it straight and lift it all the way up. And I don't let me move you down, okay? Good, awesome. Go ahead and lift it out to the side as high as you can, and back down. Go ahead and lift it up again, about halfway. Don't let me move you down. Good. All right, we're gonna do the same thing with this arm. Go ahead and lift it straight in front of you as high as you can, and down. Go ahead and lift it about halfway, and don't let me move you. Good. All right, go ahead and lift it out to the side as high as you can. Good. All right, go ahead and lift it out to the side as high as you can. Go ahead, is that as high as you can lift it? And down, and then go ahead and lift it out, and don't let me move you. Awesome. And we're gonna do the same thing with your elbow. So I want you to take this arm, and you're gonna put your bend your elbow as far as you can forward and back, and bend it about halfway. Don't let me move you down. Awesome. Go ahead and extend it. Don't let me move you up. Don't let me move you up. Good. All right. Go ahead. The same thing. Go ahead and bend your elbow as far as you can, and back down about halfway. Don't let me move you down. Go ahead and extend a little bit. Don't let me move you back. Awesome. All right. We're gonna do the same thing with your hand. All right. Go ahead and go ahead and flex your wrist and extend. And we're gonna go ahead and bend it towards your thumb side and bend it towards your pinky side. All right. Go ahead and flex it a little bit. Don't let me move you down. Go ahead and extend it. Don't let me move you back. Good. Go ahead and move your wrist towards your thumb side. Don't let me move you back. Awesome. Towards your pinky side. Don't let me move you back. Awesome. You feel okay? All right. Same thing with this hand. Go ahead and bend your wrist up, back, thumb side, pinky side. Awesome. Go ahead and bend it towards you a little bit. Don't let me move you. Good. Back. Don't let me move you. Thumb side. Don't let me move you. Pinky side. Don't let me move you. All right. Go ahead and you're gonna kick this leg out as far as you can and back in. Go ahead and kick it out about halfway. Don't let me move you down. Good. Go ahead and kick this leg up and back. Kick it up halfway. Don't let me move you down. Awesome. Now what we're gonna do is I just want you to raise both arms above your head as high as you can and back down. I want you to go ahead and take this hand and you're gonna tap it on the bed. Do the same thing with your other hand, and I'll do them at the same time. Awesome. We're gonna do the same thing with your feet. Can you tap this foot on the floor? Tap this foot on the floor, and now tap both feet on the floor. Can you alternate them? Awesome. Good job. Do your reflexes. Is that okay? All right.
Oh, that's weird.
Does it feel weird? There it is. Okay. You okay? All right. We're gonna go ahead and do here. Ready?
Oh.
Yeah. Okay. We're gonna do the other side. You just want to relax before we're just gonna do it normal. Okay. Is that hurt? I think I got it before. Okay. I'm gonna set your arm on your lap, but just relax completely, okay? Okay. And then shift your weight to the left, and then one more time, and one more time, and back to center. Good, and we're gonna practice on reaching while sitting. So I want you to go ahead and reach and take this from my hand, and take it away from me, and then give it back. Awesome, then try it with your other hand, and take it away, and give it back to me. Awesome. You feel like you're okay? Are you dizzy?
I'm good.
Okay, so the next thing we're gonna do is just get you up and moving. So I have your little walker here.
Okay.
It's a low budget hospital, but bear with me for what we have. So what we're gonna do is I'm gonna stand you up and then we're gonna walk with this. Do you feel like you can sit by yourself for a second?
Yes.
So go, it's gonna be the walker goes first and then you're gonna step towards it. The walker goes first and then you're gonna step towards it, and we're gonna do that, and we're gonna go ahead and walk out in the hallway, okay?
Okay.
First I'm gonna stand you up. Once I stand you up, I want you to just hang out for a second. I'll be holding you and I'm gonna walk behind you with your IV, okay?
Okay.
Does that sound okay? Count of 3 and you can hold on to me if you need support. Ready?
Okay.
1, 2, 3. Way up. Are you feeling okay?
Yes.
Are you dizzy?
No.
Alright, we're gonna hold on just for a second. I'm gonna bring your walker over here to you. You can go ahead and grab on. Do you feel steady?
Each.
And I'm gonna hold on. I'm gonna grab your IV and I'm just gonna be walking behind you. Okay, do you remember what I showed you?
Yes.
The walker goes first and then you go. So go ahead and take a walker and then step towards it. Good. Take a walker and step towards it. You're doing great. Walker and then step towards it. Okay. You're doing awesome.
Thank you.
Thanks, good. And open your mouth and close. Beep. 98.6. Good. We're gonna take your just heart rate one more time.
Okay, so 110/60. Sorry. Right. So the next thing that we're going to do is just called a timed up and go test.
So when I'm going to help you stand up, and when I say go, I'm going to start a timer. I'm going to walk behind you. You're going to walk down to that marker, which is the Windex bottle, down there. We're going to turn around, and then the test stops when you sit back in the chair, okay? And we're just going to see how long it takes. Is that okay?
Yes.
So I'm going to help you stand. 1, 2, 3. Good. Here's your walker. And I'm going to follow behind you. Ugh, this is not ideal. I'm going to cut that first. And, okay. I'm going to follow behind you. Are you ready?
Yes.
Timer, go.
Right, turn around. Awesome. I'm just gonna take your vitals one more time. Still 98.6. We're just gonna take your heart rate one more time. Pressure one more time. Is that okay? Yes. You're smart this time and put the IV on the other side. You ready? Yes. Just one time over the gate. Okay, ready?
Alright, we're just going to come into the bathroom here. Alright, and what I want to have you do is just practice sitting down on the toilet, okay? So you're going to just walk over to the toilet with your walker. And I know it's a little bit tight in here, so we're just going to squeeze around. Good. And you can just keep holding onto your walker, and I want you to just practice sitting down, okay? Hold on, I can help you. Ready? 1, and you can hold on to me if you need to. 1, 2, 3. Good. You feeling okay? And are you dizzy?
No,
Okay, good. Do you need a second before we get back up?
I'm good.
Alright, we're going to go ahead and stand back up, and then all I'm going to have you do is you're going to hold on to the grab bar here, and I'm just going to watch you step into the shower, alright? Ready?
Okay.
1, 2, 3. Awesome. And you're going to just hold on to me and go ahead and grab onto the grab bar here, and I'm going to move your IV out of the way. Alright, and I just want you to go ahead and hold on to that grab bar, and we're going to practice getting in and out of the shower, alright? Ready? Go. And just hold on to the grab bar, and can you just kind of pick your arm up to your head like you're washing your hair?
Yes.
Alright, good, and back down, and I'm just going to watch you step out of the shower again, so you can go ahead and turn all the way around if you need to. Be safe. Hold on to that grab bar and step out 1 foot at a time. Good, good. And I'm going to go ahead and bring your walker over to you. And if you just hold on to that, and I'm going to get your IV. Okay, I'm going to walk behind you, okay? Thank you. Alright, and we're going to go back to the room, okay?
Okay.
1, 2, 3. Awesome. And I want you to go ahead and just practice standing here for a second. And do you feel okay? Are you dizzy?
No.
Alright, good. And I want you to go ahead and try to pick up 1 foot and stand on 1 foot. Good. And then stand on your other foot. Awesome. Good job. I want you to try to put 1 foot directly in front of your other foot and try to stand like that. And you can put both feet on the ground. And are you okay?
Mhm.
Awesome. And go ahead and go back to neutral, and then go ahead and try your other foot in front. You feeling okay?
Yes.
Awesome. Alright, you can go ahead and go back to neutral. Alright, and we're just going to sit in the chair this time, okay? So just stop right here. And I'm going to set this down. And we're just going to go ahead and back your legs up until you feel the chair behind you. And we're just going to go ahead and sit down. Awesome. Do you feel okay?
Yes.
Do you feel dizzy?
No.
Open up. It goes. 98.6. Your heart rate.
We're going to take your blood pressure. Just have your arm. Is that feel okay? Yes. Okay. I need emergency too. Awesome. So I think that you did great in therapy this time. I know we worked on moving around in bed a little bit and how to sit up and sit back down in the chair. All of that is going to help you for things like using the bathroom and showering and getting in and out of the chair so you can be more independent when you go home. I think that you did great for your first therapy session. What are your main goals for therapy?
I want to be able to shower on my own.
Okay, yeah, we can definitely do that. So we'll work on that next time with a little bit more of functional tasks for you. Does that sound okay?
Yes.
Well, thank you so much. Miss is over, and we will see you next visit, okay?
Okay.
All right, thank you. Hi there, Miss Summer. How are you doing today?
I'm doing good.
And how did you do after our last session?
It went good.
And how's your head feel today?
A little better.
All right, good. I'm glad to hear that. I'm just going to go ahead and check your bracelet. And can you tell me your name?
Summer is over.
And your birthday's for 1896?
Yes.
Awesome, thank you so much. And again, that does match my record. So I think you did great after your treatment last session. I think that this time I've kind of seen what you can do and where you are. We're going to work on more functional tasks. So I know that you really want to take a shower. So we're going to kind of simulate what that's going to be like for you. We'll do a little bit more walking and some stairs. Does that sound good?
Yes.
Awesome. All right, well, I'm going to go ahead and just take a few of your vital signs. But before we do that, I told you a few things that you weren't supposed to do last visit. Do you remember what those were?
I'll hold my breath if it makes my head hurt, and lift or pull anything that makes my head hurt, and keep my head above the rest of my body.
Awesome. Yeah, that's exactly right. Awesome. So you seem like you're doing good. And do you know where we are right now?
The hospital.
And you know what day it is?
July 22nd, 2020.
Okay. And do you know what season it is?
Summer.
Awesome. Just like your name.
Just like my name.
All right. I'm just gonna take a few of your vital signs. Is that okay with you? Off and close. 98.6. You are consistent. I'm gonna come around on the other side so I can take your blood pressure. Okay.
Okay.
You mind if I sit on that with you? That's good. Okay. Go ahead and just flip your arm over, and I'm just gonna take your heart rate. It's a therapy dog. It's 100 over 58. Sorry. Okay, you can cut it. So we're just gonna start off with some little exercises. Can you just go ahead and point your toes towards your forehead and back, and the other foot, and back, and this foot, back, this foot, back, and let's go at the same time a few times, and back, up, back, and back. Awesome. All right, so the next thing we're gonna do is I just want you to bring your knee to your chest, and back, bring your knee to your chest, and back, and then the other leg, and back, other leg, and back. And I want you to just go ahead and just raise your arms in the air as you can, and back, and one more time, and back. Awesome. All right, so we're gonna go ahead and sit you up. Is that all right?
Yes.
We're gonna do what we did last time where we roll you to the side and then we sit up, okay?
Okay.
Ready? We're gonna roll on 3. You can help me as much as you can. 1, 2, 3. Very nice. And I'm gonna come underneath your shoulder. I don't wanna get your hair there. And on the count of 3, we're gonna sit up, okay? Ready?
Okay.
1, 2, 3. Are you feeling okay?
Yes.
You feeling dizzy?
No.
Okay. I'm gonna go ahead, yeah, you can just grab onto the side. I'm gonna go ahead and put this gate belt back on you. I'm gonna give you a little bit of a hug. Feeling okay? Is that too tight?
No, it's good.
And then go ahead and kind of practice marching in place. Awesome. Okay, so let me go ahead and get that ready for you. And on the count of 3, ready? 1, 2, 3. You feeling okay? Alright. Here's your walker. Do you remember how to walk with it?
Yes, ma'am.
Okay, can you tell me how you're going to do it?
I'm gonna put the walker in front of me, and then I'm gonna set my 2 feet closer to it.
Alright, good. Go ahead. Awesome. And we're just going to walk to the bathroom.
Okay.
Alright, do you remember how we did this the last time?
Yes.
So you're going to kind of wedge your way in here and turn around. And I just want you to sit on that toilet, okay? And I'm going to help you. You doing okay?
Yes.
Alright, ready? Sorry. You're good. Alright, ready? Let's drive you there. Alright, ready? 1, 2, 3. Good. And you're getting more independent with that. Does that feel good?
Yes.
You're feeling good. Alright, we're going to just try to stand up once and then sit back down once. Okay, ready? 1, 2, 3. Good. And are you okay?
Yes.
Are you ready to try it one more time? Ready? 1, 2, 3. Very nice. Alright, now we're going to stand up, and what we're going to do is we're going to get into the shower, okay? Okay. Okay. Ready? 1, 2, 3. Yeah, you're getting much better at that. So I'm going to just put this IV on the outside of the shower because I think that the pole is long enough to reach in there. Okay, so we're going to get this all steady here so it doesn't mess with us. There it is. Alright, what I want you to do is just, I'm going to open this up towards you so the door doesn't get in the way. I want you to just take a step inside the shower, okay? And I want you to grab onto the grab bar here and just take a step over. And you have a walk-in shower at home?
Yes.
Awesome. Alright, so just go ahead and keep holding onto that grab bar. I'm going to hand you things, and I want you to just pretend, I'm going to squirt something in your hand, and I want you to just to pretend to wash your hair, okay?
Okay.
Good, I want you to try to get all over your head like you would in the shower. Alright, good, and I want you to just one more time, and we're going to practice just washing your body. Make sure that you can get everywhere. And do you feel like this would be easier with a chair, or do you feel like you can stand up in the shower?
I can stand up.
Alright, awesome. Alright, do you feel okay with that? Alright, awesome. So we're going to go ahead and just practice coming out of the shower again. And I'll get your IV out of the way. Very nice. You feeling okay?
Yes.
Do you feel dizzy?
No.
Alright, I'm going to get this out of the way. And we are going to go out into our treatment area so you can practice some walking. Does that sound okay?
That sounds good.
Alright, so go ahead. So based on what I'm seeing, I don't think that we're ready for stairs yet. So we're going to start off just doing some walking practice. Does that sound okay?
Yes.
Alright, so we're going to go ahead and do 1 lap around the gym here, okay? You're doing awesome. Are you dizzy?
I'm good.
Are you in pain?
No, I'm good.
Good. Do you feel like you need a break?
I'm good.
Alright. Think you can make it to where we started?
Yes, ma'am.
Okay. Alright, we're just gonna go and sit in the chair, okay?
Okay.
And again, you're just gonna turn around until you feel that chair on the back of your legs. And sit down. Awesome. Alright, I'm gonna set you up here, and are you dizzy?
No.
And are you in any pain?
No, I'm good.
Alright, I'm going to close. 98.6. Fine. Awesome. Okay. Remember number 16. Alright, Mrs. Over. I think that you did great in your therapy today, and I have really high hopes for your prognosis. I think that there's a few more things that we need to work on. I'm going to get you stronger with your gait and eventually get rid of this assistive device, and I'm going to do some stair training with you at our next visit. I think you're making great progress. Do you have any questions or concerns for me?
I don't.
Well, I think that you're doing great, and we will see you at the time of the next visit. Thank you so much.
No problem.
Okay, let me double check